the job of being Minister responsible for mental health, I regarded it as an opportunity to fight the cause for equality, really, for people who suffer from mental ill health, so that they're treated equally. They're treated in the same way as people who have other illnesses. And to address the real injustice that I think exists in our country, but I suspect exists elsewhere, that if you have a mental health problem, you don't get treated in the same way. You don't get the same access to treatment. You don't get the same access to good evidence-based treatment. When you're in a crisis, you don't get support in the way that others do when they have a physical health crisis. And then the really awful scandal of the way in which we treat children and young people. In the United Kingdom, probably 75% of children and young people with mental ill health get no support at all. They often have to wait a very long time. And I can't begin to tolerate that. And, you know, we have experienced mental ill health in our family with our oldest son. And so I have a degree of empathy with all those people who have gone through awful trauma, trying to get help. And indeed, all those people, those families who suffer the loss of a loved one, who ends up taking their own life because they haven't been supported properly. So I regard this as a moral imperative. I think we have to fight to ensure that people get access to support when they need it. There's also an overwhelming economic case as well, because the cost of mental ill health in our country is reckoned to be about £105 billion every year. So neglecting it is both morally wrong but also economically stupid. So for those reasons, I'm very driven to achieve the goal of genuine equality of access to good treatment. But I'm also driven by something else which I think is equally important, and that is trying to prevent ill health in the first place, adopting public health approaches which reduce the incidence of ill health in the first place. And I think that has to be increasingly where our attention is focused. So I guess two things. First of all, at a national level, my job as an opposition member of Parliament now is to hold the government to account. My party, the Liberal Democrats, fought for and secured extra funding for children and young people's mental health, another 1.25 billion over the course of this Parliament. I've got to make sure that the government actually spends that money as it was intended, because the need is overwhelming. But secondly, I'm involved as chair of a commission in the West Midlands, and I want to talk about this a bit more when I come to Canada, because increasingly we're seeing around the world fascinating developments of big city regions doing some significant work on mental health, looking across the whole of the city region. So New York have produced Thrive NYC, Philadelphia, Vancouver has a mental health project led by the mayor. The West Midlands is now doing this work led by me. And the whole exercise is to look how we spend public money and to ask the question, can we spend that money more effectively to prevent ill health, to stop people drifting into really acute mental ill health, but if they have significant mental ill health, to ensure that they get access to treatment quickly. And it's a fascinating piece of work. We're looking at how we keep people in employment, how we get people back to work when they're unemployed, how we get them into good housing, and some of the things we're learning from Canada. But we're also looking at how we stop the drift into the criminal justice system. So, I think what I'd love to see is a growing movement across the world of cities, big city regions, doing really exciting, innovative work and linking up with each other, learning from each other, sharing experiences. And I think in that way, we will all benefit. It was a central focus of my attention as a minister, because when I looked at the way in which children's mental health services in our country operated, I was really horrified by the extent to which they let people down. And it was absolutely, as you say, a reactive service, which only reacted once someone was really ill. So we set up a task force which reported last March, and they came up with a report called Future in Mind. And this is a sort of blueprint for the modernisation of children and young people's mental health services. And at the heart of it is prevention, working in schools, getting schools much better equipped to support young people, to stop the problems developing in the first place, to have mental health workers training together with teachers in school so that they learn from each other, so that they can identify problems much more quickly. So this is at the heart of the approach that we now want to take. I suppose I want to try and articulate a mission that I think we all need to be on, whether we're in England or in Canada or anywhere else in the world, to address this awful injustice of the way in which people with mental ill health are treated by the system, and both the moral and the economic case for change. And I want to sort of set a tempo, an absolute imperative that we change the way the system works, because at the moment we're letting people down in a horrible way, and whole families. And the cost of this is so dreadful for society as a whole. And I want to try and demonstrate some of the things that I've done in the United Kingdom, both at a national level but also at a regional level, and to suggest what's possible in a way that we can achieve change, but it requires inspired leadership. And someone has to lead from the front and make the case, the moral and the economic case for change. And I want to help you in that endeavour, because I think we owe it to those families who experience mental ill health to do much better than we do at the moment.